Welcome to Single Parent Success Stories. This episode is all about holistic wellness. My guest is Dr. Julius Torelli, who had spent over 3 decades in cardiology, but his path took a turn when he realized that Western medicine alone could not address the root causes of many chronic illnesses. In this episode, we dive into the mind-body connection, the power of gratitude, and why self-worth may be the key to true healing. Welcome to Single Parent Success Stories, a podcast designed to inspire single parents. Here you'll find resources from self-care to finances to parenting and everything in between. Discover what it takes to thrive. Let the stories inspire you to what is possible. Before we start the next conversation, I want to invite you to check out my amazing book, The Gift Inside, a powerful guide for healing your body, mind, and soul. Reclaim your strengths and awaken your true potential. Whether you are navigating heartbreak or simply seeking deeper fulfillment, this book offers the tools to turn your struggles into triumphs. It is time to unlock the gift within you. Available now on Amazon, or you can check it out on my website www.irinashahovtsov.com. Hello and welcome to Single Parent Success Stories. Today we have a special guest, Julius Torelli. He's a cardiologist with 4 decades of experience who has evolved his practice into a comprehensive holistic wellness and preventative approach. His work focuses on mindset and health and illness. He incorporates the often overlooked non-physical aspects of health, including mental, behavioral, emotional, social, cultural, and spiritual dimensions, and explores how mindset profoundly impacts our well-being. Welcome, Julius. It is a pleasure to have you.
Good morning, Irina. How are you? It's great to see you again.
Good morning. Doing good. Thank you for coming.
Thank you for having me on. I'm honored.
Please share with us in your own words, who is Julius outside of your introduction?
Well, that's a challenging question. When I look at my roles and such, a lot of what, as you said, I'm a cardiologist. I've been, graduated from medical school in 86, finished my training in 92, so 30 plus years of cardiology. And, over that time, I've had professional and personal issues, of course. And over that time, those both evolved, and my practice evolved as I guess that's why they call it practice, right? As I saw more and more of what Western medicine did well and what we sort of struggle with in Western medicine. And so my practice evolved into a more, what I like to think of as more holistic practice. What I found that in Western medicine, in medical school, we're taught, we focus on the physical. The physical is where symptoms manifest, where illness manifests, and Western medicine is a very much an illness-based model of healthcare. And so we tend to do pretty good with acute situations, when there's something, especially if there's something that we can go in and fix, like a broken bone, we can go in and mend it, set it. If you have appendicitis, we can take out the appendix. If you're having a heart attack, we can stop the heart attack. So if there's something physical going on that we can go in and operate on or do some procedure on, Western medicine does pretty well. And the progress in technology in my professional career has been unbelievable, really. So that's all sort of the good part. I think the challenging part in Western medicine is when we don't find anything. So people come in with symptoms, illnesses, and we do all of our tests, and we never run out of tests. We always have more tests we can do, but we don't find anything physical, right? And so the typical common scenarios like that are like headaches, right? Like migraine headaches and tension headaches, what we call belly pain or irritable bowel syndrome. Those are 2, I think, sort of poster childs for what are termed medically unexplained symptoms. So these symptoms can be very debilitating, maybe even disabling for people. But yet if you do, diagnostic tests, x-rays, CT scans, MRIs, you don't find anything, right? Most people with a headache don't have a brain tumor or an aneurysm or a bleed in the head or something like that causing their headache. And so we understand that those are more, we'll admit that those are in Western medicine, we call them stress related. I like to think of them as emotionally related or maybe even behavioral related. But, we don't know what to do with it because there's nothing to fix now, right? There's no procedure, there's no surgery. So the only other thing in our toolbox to fix things is medication, right? Pharmaceuticals. So we start with the pharmaceuticals, and pharmaceuticals have come a long way from migraine headaches as an example. We have medicines now that can prevent migraines. We have medicines that treat migraines pretty effectively. But again, they don't get at the foundational issues. And so in Western medicine, we tend to do that in general. Very rarely do we get to the foundational issues. If you look at pharmaceutical medications as an example, most of them, the great majority, are not curative. Right? Outside of antibiotics, which can be curative, but outside of that, most chronic diseases, medicines are something that you have to, buy every month, take them every day, and forever. They don't cure. And again, that's not to badmouth pharmaceuticals. They may be very effective for preventing migraines or for treating cancer or high blood pressure. High blood pressure is a great example, right? If your blood pressure is high, we know that's bad. And we've got studies that show bad things happen. And then you develop some kind of treatment, pharmaceutical treatment. And then you do a study to show you take this medicine, the blood pressure comes down, and the outcomes are better, right? So we show that there's improvement. But we stop there. No one ever gets to, well, why is the blood pressure up to begin with? We don't ask that question. We just I like to say we start in the middle and we never get to the root cause for the most part. So that's what I saw was lacking in Western medicine. And a lot of that, again, tends to be lifestyle issues, emotional issues, behavioral sort of issues, sometimes, social or cultural kind of things, and even spiritual. And so that model just evolved into a practice where if we didn't find anything physical, then we started to look at these other aspects of health to see, what can we do with that? The challenge there, again, is that I wasn't taught any of those things, right? In medical school, again, we spend about 2/3 of our time in diagnosis and maybe 1/3 of our time in treatment. But I wasn't taught anything about how do you treat those aspects, those non-physical aspects of health. So I had to go out and really research that. I had to get, additional training, additional background in all of those things. And some of it is still out of my expertise. And so I still refer people a lot to, counselors or therapists or psychologists and things like that.
Totally. Thank you. Yeah. You pointed out a very important distinction that yes, we only focus kind of on end result and physical is the end result because meanwhile our body has been sending us signals but we weren't paying attention and finally body is screaming when something is broken or something on a physical level we can see and feel, then we pay attention. But before we weren't. And in medical system, it's a sick care system. It's there to support people who are sick instead of creating a lifestyle of wellness and preventative things and helping people along the way to create a better lifestyle so they don't end up sick. But of course, it's great to have when the bone is broken and you can go and fix immediate right away. But I think a lot of time, it would be nice to shift the focus from sick care to preventative wellness care. And it's awesome that, as a cardiologist, you were able to arrive at that conclusion yourself through your practice, through your experiences that the schools don't teach that aspect of things. So
yeah, you bring up a great point, actually, and that is, I always believe that it's easier to cure an illness if you never get it in the first place.
Right.
And so, but you bring up a good point, and that is a lot of these, what become illnesses, let's use migraine headaches as an example, right? You're right. There is something, before you actually develop the headaches, the issues, the emotional issues or behavioral issues, the lifestyle sort of issues have already started. Diabetes is another great example, right? Yes, you may probably have to have the genetic predisposition to have diabetes, right? But in addition to that, you can modify the expression of those genes by your lifestyle. And so before you ever develop diabetes, you can do things, changing your lifestyle, about, looking at what you eat, being more active, losing weight or not gaining weight and things like that. And then you could do that before you actually develop the diabetes. But what we do in our society is, like you said, we wait till that end result, which is the physical manifestation of those lifestyle issues.
Yes, totally. So what have you found in your practice? What is the most important thing, do you think, when it comes to health?
I thought about that a lot, and there are several things, but I think the number one thing that you have to maybe change is the right word, because in our society, the responsibility for healthcare, for your health and your healthcare, is generally put on the provider, the physician or your healthcare provider. In other words, you wake up in the morning, you have a headache. You do your normal thing. You take some aspirin or some Tylenol or some Advil, whatever it is, and the headache doesn't get better. Maybe the next day it's worse. So then you now I need to find out what's going on. So now you go to your physician and you expect two things from your physician. You expect him, one, to figure out what's going on, and two, you expect him to fix it. And so he says, maybe does an MRI or whatever, says there's nothing there causing a headache. This is a migraine. We're going to put you on this medicine to prevent migraines. But if you get the migraine while you're on that, we're going to give you another medicine to treat the migraine in case you get it. And then, you seem like you're a little bit depressed, so we're going to put you on this antidepressant medicine as well. And it sounds like you're not sleeping well, so here's this other pill to help you sleep a little bit better. And, it sounds like your life is tough, and so maybe you need something to help you relax. So here's a sedative as well. So the next thing you know, you're a single mother, and you're 40 years old, and now you have migraine headaches, and now you're on 5 medicines, and none of them treat the root cause of your issue. So because you have given the control or all the responsibility for your health and healthcare onto the physician. So the first thing I think that has to change in our society is people have to become willing to take some degree of responsibility for their health and their health care. And that's different. That's not typical in our society. And so I think that's first and foremost, I think. And then number two, I think people have to start to realize how the effect of lifestyle on our health and the effect how powerful thoughts and beliefs and mindset is with relating to health. We talk about mindset a lot today in our society. It's a kind of a fad, right? A phase that we're all talking about mindset for everything. But mindset does affect health as well. And so that, I think, is also important. And then, of course, third, I think, is trying to find ways to reframe your mindset or change that mindset and beliefs and such. So those are sort of the 3 high-level phases I sort of think of it as.
Totally. I think mindset affects everything, all areas of our life, not just the health, but everything we do. The way we approach life when life becomes difficult, how do you face it? Do you bow down, or do you say, I'm going to change, I'm going to survive, I'm going to do something different? So how can we, incorporate the non-physical dimensions of being into Western medicine? What is your advice for that?
So I think that the first thing, I always got to emphasize this because I don't want to come across like I'm throwing the baby out with the bathwater. Okay, so there are a lot of great things in Western medicine. If you have a headache or belly pain or chest pain, you want to make sure there's not something physical going on causing your problem. So as a cardiologist, I saw people, obviously, a lot of chest pain, palpitations, and things like that. If you come in to see me and you have chest pain, the first thing you're going to get is a standard Western evaluation to make sure, one, you're not having a heart attack or unstable angina, or you have heart disease or some kind of issue, physical issue that needs to be addressed. So that's first and foremost. If you're having headaches, get an evaluation. If you're having belly pain, make sure you don't have Crohn's disease or appendicitis or who knows what. So that's first and foremost. And 90% of the time, you don't have that. You don't have anything physical. So then after that, you can then start to look at, if let's just use headaches because that's what, that's a good one. If I'm going to start to look at this, we know that these are quote unquote stress related, right? So what is it in my life specifically that, may be stressful? And especially if you look at single parents, there's a lot of different stressors, right? But we put, different we put different emotions in different parts of our body. So what specific emotions or what specific lifestyle issues may be relating to your headache? So it may be something at home, maybe with a parent or a child, or maybe it's at work. Maybe you got a boss that you can't stand, or maybe just the company in general is difficult to work for, or what have you. So you need to sort of figure that out. And so that's, sort of the lifestyle part of it. And then you have to begin to figure out, what are you going to do about that? Take responsibility. Now, you may not be in a position where you could just quit your job and go, try to find some, you're a single parent, you're trying to, make ends meet. I totally get that. So I'm not saying that you necessarily just, if it is your job, as an example, I'm not saying get up and leave and, be irresponsible. But you can start to look at your job in a different sort of way and start to do some reframing. And I use gratitude for that. You could use cognitive behavioral therapy. I'm not a therapist, but again, using therapists, I can teach you cognitive behavioral therapy or DBT or many other sort of therapeutic reframing techniques that exist out there today that I think are very effective. But even gratitude I like because it works almost instantly. It's easy to do, and you can do it on the fly. So, there's a lot of talk about gratitude being used like a gratitude journal, right? Write down every day, in your journal, 3 things or 5 things or 10 things that you're grateful for. It's effective. There's many studies that show that is effective. Having said that, you also have to have time to do it. Right? And again, being maybe a single parent, even if it's 10 minutes, you may feel like, I don't have 10 minutes. I don't have enough time to go to the bathroom. I certainly don't have 10 minutes to do a gratitude journal. So the nice thing about the gratitude is you can actually do it on the fly as well. So I call that intentional gratitude because you have to intend to do it. And I use a method I sort of talk a lot about. I call it the gratitude traceback method to really amplify the gratitude. So you can just take one thing in a situation. It doesn't matter what the situation is. Something where you're having a negative response, a negative emotion. Could be at the grocery store because you're in the slowest line all the time and you're running late. Could be that you're stuck in traffic and you're running late and you left late, so you're beating yourself up. That's a good one, right? You can, because you left late, there's traffic that you didn't expect. Well, you should have predicted it. You can start to beat yourself up. Why do I always leave late? What is wrong with me? I'm so no good. I'm such a terrible person because, now I'm going to be late for this meeting, and then you can sort of perseverate on that or make it pervasive, where now I'm going to be late. I'm going to be late again. Maybe they're going to get mad. Maybe they're going to fire me. I'm a single parent. So you can amplify that, right? And catastrophize it, as they say. Or you can choose to, if you're stuck in traffic, you can't do anything about the traffic. I mean, it's there. That's what is. So if you can accept that and you don't fight against it, because anytime you fight against what is, you're going to lose. That's just the way it is. But so you can change or reframe the way you look at the traffic. So you may be stuck in traffic and say, it's 97 degrees outside and my car has air conditioning. Thank God that I have air conditioning, that I'm at least not hot. Now I've got a few minutes. There is this great podcast on single parenting that I think I'm going to have time to listen to now. So I'm going to listen to that while, and that doesn't solve the fact that you're going to be late, but that's something, again, that you have to, that's what is, right? So you have to become aware of that and accept that, right? So there's a lot of self-awareness, a lot of self-acceptance involved with that as well.
I love gratitude. I think our mind is such a fascinated machine that it has this ability when you focus on something. I'm going to give you more examples. So when you focus on gratitude and you're focusing on things that are working in your life, and suddenly you might realize there are more things working because you set an intention and focus. And yeah, like you said, focus on, yes, what is, you cannot change, but we can always change how we react to the situation. So whenever I am stuck in traffic, I say, bless the traffic, bless the road, bless the car that I'm in. Thank God I have a car.
Exactly.
And it's working.
Yeah. And it's interesting because most people, what you just described is easy to do. It's not difficult. Yet when you tell people, most people can't do it or won't do it. And the reason is because they've chosen what I like to call the victim path. They've chosen this path of victimization to say, this is not my fault. This is being done to me. I left on time. It's the traffic. I'm going to be late, but it's the traffic that's doing that to me. It's not me. That's but that's the conscious part. Unconsciously, you're actually beating yourself up because unconsciously you're saying, I'm no good, it is my fault, and such. So when you choose that victim path, that's a trap, right? Because once you choose the victim path, it's now out of your control, right? So now you can, get angry as you want at the traffic, and you can blame it, saying, it's a traffic fault, not my fault, not my fault. And the only thing that's going to happen is you're going to get your headache, your blood pressure is going to go up, your heart rate's going to go up. Good things are not happening inside of you when you do all that. And that's a choice. And that is really hard for people to accept, what I like to call the victor path or the non-victim path, and say, take responsibility, not blame. Blame and responsibility are different things. Excuse me. You don't have to take the blame, but take the responsibility and then start to look at this like you did in your car in a different way. And the gratitude is just an easy way to do it.
Yes, thank you. I love it. And thank you for describing for listeners out there, when you think you are angry, you're just angry. What's happening on a physical level, what happens to your body. Well, given that you're a cardiologist, you have that leverage.
That's very important.
Years of experience.
Right.
And
well, there is a physiology to our emotions, there's a physiology to our thoughts that I don't think we emphasize it. We don't talk about it in medicine. We certainly don't emphasize it in our society in general, but it's easy when you stop and just think of it, right? I always use the lemon example, right? If you sit down and relax and you picture a lemon and you picture cutting that lemon and then you picture biting into that lemon, you will salivate. There's no lemon, right? You're not salivating because of the lemon. You're salivating because of the thought of biting into the lemon. That's how powerful thinking can be, right? If you get startled, something happens and you get startled, your heart starts racing, right? Your palms get sweaty, your blood pressure goes up. That's a thought over, what was that noise? It's not the thing that happened that's doing it. It's the noise and it's the thought of someone broke into my house. And, that's what we're reacting to. And that changes physiology. The thought causes secretion. It basically activates the autonomic nervous system, the sympathetic part of the autonomic nervous system. So you release catecholamines, like adrenaline and things like that. And that makes your blood pressure go up, blood vessels constrict, heart rate goes up. So there's a physiology to thoughts. There's a physiology to mindset, to beliefs.
Yes, totally. I think in the past it used to be, this is the material thing, but everything starts with the idea, with the thought that we have. And the idea and the thought causes the thing to materialize in physical existence. Like this podcast, I had no idea what the podcast is about. I had an idea about it, and I created it.
There you go. That's exactly right.
Thank you. What is your superpower if you had to pick one?
So one of the things that I have come to realize as I've evolved, because, I had my own issues decades ago, 30 years ago. And over that time, I've come to realize that we're all the same. The spiritual sort of sense, there's a sense that we're all one. And that's a hard thing for us to say, right? Because you're like, what do you mean we're all one? I can touch you, you're not me. I can go touch a tree and it's separate from me. How am I one with all of this, right? But as I start to think of and look, especially at people, it's clear to me that all of us have what I'll call self-esteem issues or self-worth issues. It's universal. It's everywhere. Now, some people have a little and some people have a whole lot. So there's degrees, but it's present in everyone. And I believe that drives all human behavior. That lack of self-worth or that not good enoughness feeling drives all human behavior. Either you try to prove it directly, and criminals do that, right? All bad things. And that's basically saying, I told you I was no good. Or most of us more commonly is you try to cover it up. And so you try to do really good things. And that's basically to show, hey, see, I am good. But unconsciously, you still have that belief. And when you look and when you think about human behavior in that way, it becomes a superpower. You can predict all human, whether it's true or not, I don't know, but when you look at it that way, and I don't care where you are, You could be stuck in traffic and you could be in a boardroom. It doesn't matter. You look at everyone and their behavior coming from self-worth issues. It's like having a superpower. You can almost predict like behavior based on that.
Totally. You're so right. Was there any book that inspired your journey that you can recommend or was transformational in your life?
There's been many books, but I think if I had to pick just one, I think Man's Search for Meaning by Viktor Frankl. Very powerful book for me, because that's, what he describes there in the concentration camps is a very small percentage of the people did not get depressed. I mean, being in a concentration camp is a pretty depressing thing. I would think it's universal, but he said it wasn't universal. He said there was a small percentage of people who tried to uplift other people who didn't get depressed. And the interesting thing is those people were more likely to survive. And so that, and he says, and so you have to search for meaning from that. The thing about life is having a meaning. And it's interesting about that because I just saw a article, I think it was this morning or maybe it was yesterday morning, on a physician, the oldest practicing physician. He practiced until he was 99, he's now 102. He said the most important thing is having meaning in your life. And he loves practicing medicine, and that gave him a lot of meaning in his life. And so I think that book had a lot of influence on me.
Yeah, I love that book. And I call it, there was a study of centurions, people who live to 100 years old, and one of the zones is Japan, and Japan has this amazing concept of ikigai, when you combine the things that you are great at, what you can get paid for, and the purpose. And people there, they don't actually retire because they live that purpose even after retirement age, but they continue, and that's what makes them keep on going. When you kind of think about your life, what's the meaning of life? Why am I here? It's not just to survive, but it's to create something, to have. I think we all have a gift inside of us, and it's up to us to find what it is and share with others.
I think it's very important. I always sort of like to think of, what would you be doing if money weren't an issue and time weren't an issue? What would you be doing? And those, you should try to pursue that, even if it's just as a hobby. I think it's very important. And most of us don't do that. In our society, in the West, and in America specifically, so many people just work, for the paycheck, and they sort of live for the weekend, and they can't wait to retire. And then they retire at 65 and they're dead at 66. Yeah.
So how would you answer that question? If money and time was not an object, what would you do with your life?
And so for me, I think about this all the time. I was like, I'm 65 years old this point, and I've made many transitions. And right now I'm starting a company called Gratefully Well, which is basically what we're doing here. And it's trying to take what I did one-on-one with patients for 30 years and trying to transform that into an educational digital platform called Gratefully Well. And so I have a newsletter on Substack where I write about these concepts. That newsletter is called Gratefully Well, and it's free. I encourage people to subscribe to that. I have a book on gratitude called Holistic Health Pathways that's available on Amazon. That book is specifically about the physical and mental health benefits of gratitude. And so that's another thing. And I have a website called gratefully.well.com where I have a 7-day challenge. And basically, what Gratefully Well I'm trying to do is establish a community of like-minded individuals who are first willing to take responsibility for their own healthcare, and then looking for resources, looking for support and workshops and things to start to implement these pathways, regardless of whether they're healthy and want to stay healthy, or they have medically unexplained symptoms like migraine headaches or irritable bowel, or even if they have chronic diseases, known chronic diseases like heart disease or diabetes or cancer. These are still very powerful principles, because again, these principles aren't such that you have to throw out the Western medicine techniques. If you have cancer and you're getting chemotherapy, we have studies that show that people who go to support groups who have cancer do better and live longer than people with cancer who don't go to support groups. So, these things can be implemented, they can be integrated, with the standard sort of treatment. If you have diabetes, see your doctor, take the medicine to lower your blood sugar. Those do good things. But while you're doing that, do these other things to sort of look at your lifestyle, change your lifestyle, and start to implement them. And these things don't have to be drastic. When we talk about in Gratefully Well, we talk about For instance, we don't talk about exercise, we talk about activity. You don't have to go out and start running marathons if you're diabetic. You just need to live a more active lifestyle. I think it's important for, single parents where yes, I don't have time to be active because, I can't take care of myself. Well, I have my kids that take care of myself. Well, go out and do things with your kids, maybe get bikes and, you can ride bikes together. That's exercise, right? That's being active, and you're doing it as a family. I think there's additional benefit, from doing that. I think there's also additional benefit from being outside. A lot of people go to the gym and walk on a treadmill. I call the treadmill the least effective form of exercise. It is effective. I'm not going to knock it. However, there's something not normal about walking for 45 minutes and not getting anywhere. Okay. And so if you can be outside, good. If you can be with your kids and your family, even better. Right? So activity. We talk about nutrition. We don't talk about diet, because when you take a diet, you think about weight loss. Yes, the weight loss is important. But if you think about it from a holistic nutritional standpoint, what should I be eating? What shouldn't I be eating? The weight loss will sort of come. You be more active. Eat more, less processed foods and things like that. Those become very important things.
I love it. Thank you. That's incredible. And thank you for the work that you are doing.
Appreciate it.
It's such needed. And the fact that you're coming from a cardiology perspective and shifting your way to more holistic, energy, kind of wholesome well-being lifestyle is important.
Thank you.
What is do you have one non-negotiable that you do for yourself every single day?
Well, yeah, I have several. So meditation for me is critically important. And, when you use the term meditation, some people think you've got to sit in a lotus position, and Om and things like that. It's really just a matter of, for me at least, just sitting in stillness and basically allowing this natural sort of process to bubble up forwards. I differentiate thinking from thoughts. So, if you need to solve a problem, you think about it, right? I got to do this, or I've got to make dinner. That's thinking, right? I've got to go and take the laundry or whatever it is. But thoughts are like what happened in the shower. Everyone will tell you, my best ideas come from when I'm in the shower or when I'm out walking. Those are thoughts. And I think that those don't actually come from us, our brains, our thinking brains. It comes from some other place. I don't know what to call it. Universal mind. I have no idea what to call it. They didn't teach me in medical school about these things. But you have to, if you're thinking too much, you stop that process of this universal mind and the thought kind of process. So I think meditation is key. And then activity is very key. I walk for almost an hour every day, about 50 to 55 minutes. I try to walk about 3 miles, and I do that with my dog, and I do it in nature. I do it outside of weather permitting. I think that those are both very important for me.
Totally. I love it. I call meditation the inner shower of the mind. You know how in the morning we shower, we want to smell fresh.
There you go. You see, so it's the same thing. I think that's why I use the shower. I think showers can be a very meditating thing. People love showers, hot shower, whatever it is. I don't know about this cold shower thing, or ice shower, ice bath, whatever. But most of the people enjoy the shower, and it's a relaxing time where it is sort of a mini meditation, right?
Awesome. Thank you. I love that. Anything I haven't asked that you would like to share?
I think you've hit on most of it. I'm doing a free workshop. It was going to be a 3 or 4 week workshop, and I'm still going to do that. But I think I'm going to start off with a master class that kind of gives the background of Gratefully Well and then some tools to do. And that'll be at the end of August that I'll do that master class, and that'll be free. And then I think people are a little bit intimidated to sign up for a 3 or 4 week workshop, even though there's no cost to it, just because they're not sure if they want to make that commitment. But I think the master class will help them sort of see what it's about and see if it's for them.
Thank you so much. If people would like to connect and learn more about you, where would they go?
They can go to gratefullyWell.com. The best way, though, I think, is through the newsletter. So the newsletter is on Substack.com. If you search for my name, or I guess you can search for Gratefully Well as well. But find that newsletter, and you can email me through Substack as well. Otherwise, you can go to admin@gratefullyWell.com. That will come to me as well.
Thank you so much. It's been a pleasure to have you. We'll include everything in episode notes. Thank you for sharing your wisdom and being on the podcast.
Well, again, I'm honored and I appreciate the opportunity. So thank you.